A nurse teaches parents how to have their children learn impulse control and cooperative behaviors. This would be during which of Erikson's stages of development? 1. Trust versus mistrust. 2. Initiative versus guilt. 3. Industry versus inferiority. 4. Autonomy versus sense of shame and doubt. Answer 2. Initiative versus guilt. Rationale. Toddlers are learning that parents and society have expectations about behaviors and that they must learn to control their behavior. During a health screening of Hispanic children for lead poisoning, the initial question the nurse should ask is A. How old is the house you are living in? B. Do you eat canned foods from the United States only? C. Are there any areas in your home where paint is chipping off? D. Do you use ceramic containers made outside the United States for cooking? Answer D. Do you use ceramic containers made outside the United States for cooking? Rationale. Questions addressing the age of a house where lead paint was used targets only children whose exposure to lead is through lead-based paint. During the last 2 decades, assessment of children from homes with lead-based paint has resulted in a 90% decline in the overall number of children affected. However, the risk for Hispanic children has remained steady. Lead-based paint is not the primary source of lead poisoning for these children. Food and culturally defined health practices bring additional unscreened risk to this population. Foods packaged or canned outside the United States, foods prepared in ceramic containers or pottery made outside the United States, and wrapped Mexican candies all increase lead exposure to these children. Another common risk for these children is in-home remedies containing lead. An 18-month-old child is noted by the parents to be angry about any change in routine. This child's temperament is most likely to be described as 1. Slow to warm up. 2. Difficult. 3. Hyperactive. 4. Easy. Answer 2. Difficult. Rationale. Children described as difficult adapt slowly to new routines and express their emotions forcefully. They like consistent structure. 9-year-old Brian has a difficult time making friends at school and being chosen to play on the team. He also has trouble completing his homework and, as a result, receives little positive feedback from his parents or teacher. According to Erikson's theory, failure at this stage of development results in 1. A sense of guilt. 2. A poor sense of self. 3. Feelings of inferiority. 4. Mistrust. Answer 3. Feelings of inferiority. Rationale. School-age children need to feel real accomplishment and be accepted by peers to develop a sense of industry. Which of the following are examples of the conventional reasoning form of cognitive development? Select all that apply. 1. A 35-year-old woman is speaking with you about her recent diagnosis of a chronic illness. She is concerned about her treatment options in relation to her ability to continue to care for her family. As she considers the options and alternatives, she incorporates information, her values, and emotions to decide which plan will be the best fit for her. 2. A young father is considering whether or not to return to school for a graduate degree. He considers the impact the time commitment may have on the needs of his wife and infant son. 3. A teenage girl is encouraged by her peers to engage in shoplifting. She decides not to join her peers in this activity because she is afraid of getting caught in the act. 4. A single mother of 2 children is unhappy with her employer. She has been unable to secure alternate employment but decides to quit her current job. 1. A 35-year-old woman is speaking with you about her recent diagnosis of a chronic illness. She is concerned about her treatment options in relation to her ability to continue to care for her family. As she considers the options and alternatives, she incorporates information, her values, and emotions to decide which plan will be the best fit for her. 2. A young father is considering whether or not to return to school for a graduate degree. He considers the impact the time commitment may have on the needs of his wife and infant son. Rationale. Adults recognize that there are various solutions to problems and that different situations demand different solutions. Decision-making includes consideration of the potential impact of a situation on others. Avoiding punishment is a pre-conventional stage of reasoning. Elizabeth, who is having unprotected sex with her boyfriend, comments to her friends, "Did you hear about Kathy? You know, she fools around so much. I heard she was pregnant. That would never happen to me." This is an example of adolescent. 1. Imaginary audience. 2. False belief syndrome. 3. Personal fable. 4. Sense of invulnerability. Answer 4. Sense of invulnerability. Rationale. Adolescents can be risk takers and believe that they are immune to the negative consequences of behaviors. They are just beginning to be future-oriented in their thought process and see everything as black or white. According to Piaget's cognitive theory, a 12-year-old child is most likely to engage in which of the following activities? 1. Using building blocks to determine how houses are constructed. 2. Writing a story about a clown who wants to leave the circus. 3. Drawing pictures of a family using stick figures. 4. Writing an essay about patriotism. Answer 2. Writing a story about a clown who wants to leave the circus. Rationale. As adolescents mature, their thinking moves to abstract and theoretical subjects. They have the capacity to reason with respect to possibilities. You are caring for a recently retired man who appears withdrawn and says he is bored with life. Applying the work of Havinghurst would help this individual find meaning in life by 1. Encouraging him to explore new roles. 2. Encouraging relocation to a new city. 3. Explaining the need to simplify life. 4. Encouraging him to adopt a new pet. Answer 1. Encouraging him to explore new roles. Rationale. The activity theory states that continuing an active, involved lifestyle results in greater satisfaction and well-being. When preparing a 4-year-old child for a procedure, which method is developmentally most appropriate for the nurse to use? 1. Allowing the child to watch another child undergoing the same procedure. 2. Showing the child pictures of what he or she will experience. 3. Talking to the child in simple terms about what will happen. 4. Preparing the child through play with a doll and toy medical equipment. Answer 4. Preparing the child through play with a doll and toy medical equipment. Rationale. Preschoolers are in the pre-operational stage of cognitive development and learn more easily when play is used to teach. Allison, age 15 years, calls her best friend Laura and is crying. She has a date with John, someone she has been hoping to date for months, but now she has a pimple on her forehead. Laura firmly believes that John and everyone else will notice the blemish right away. This is an example of this. 1. Imaginary audience. 2. False belief syndrome. 3. Personal fable. 4. Personal absorption syndrome. Answer 1. Imaginary audience. Rationale. Adolescents are quite egocentric and have the belief that everyone is focused on them and sees all of their flaws. Dave reports being happy and satisfied with his life. What do we know about him? 1. He is in one of the later developmental periods concerned with reviewing his life. 2. He is atypical, since most people in any of the developmental stages report significant dissatisfaction with their lives. 3. He is in one of the earlier developmental periods, concerned with establishing a career and satisfying long-term relationships. 4. It is difficult to determine Dave's developmental stage since most people report overall satisfaction with their lives in all stages. Answer 4. It is difficult to determine Dave's developmental stage since most people report overall satisfaction with their lives in all stages. Rationale. Each of the life stages can be achieved successfully and result in satisfaction, including old age. Which of the following activities are examples of the use of activity theory in older adults? Select all that apply. 1. Teaching an older adult how to use email to communicate with a grandchild who lives in another state. 2. Introducing golf as a new hobby. 3. Leading a group walk of older adults each morning. 4. Engaging an older adult in a community project with a short-term goal. 5. Directing a community play at the local theater. Answer 1. Teaching an older adult how to use email to communicate with a grandchild who lives in another state. 2. Introducing golf as a new hobby. 4. Engaging an older adult in a community project with a short-term goal. Rationale. Activity theory aids cognitive performance by using new approaches. A daily walk would not be a new activity, and the repetitiveness of it would not meet the definition of activity theory. Activities that have short-term goals can be engaging for older adults. The nurse is teaching a class to students of pediatric nursing on comparing the concepts of growth and development. Which statement most accurately represents these concepts? A. Growth patterns are qualitative changes. B. Growth is from the head to toe or cephalocaudal. C. Development reflects an increase in the number and size of cells. D. Development is a gradual change that includes advances in skills. Answer. D. Development is a gradual change that includes advances in skill. Rationale. Growth refers to changes in the structure, reflects an increase in the number and size of cells, and results in an increase in the size and weight of the whole or any of its parts. During childhood, physical changes in head circumferences, weight, height, and overall body proportion are part of growth. Growth also refers to increases or decreases, as in old age, in the size of organs and systems. Development refers to gradual change and expansion of ability and advance in skill from lower to more advanced complexity. In contrast to growth, which is a quantitative or precisely measurable change, development is a qualitative change. Development has best been conceptualized as a process that is assessed as following certain sequencing of patterns. However, the timing of the advancements are individual. When caring for a middle-aged adult exhibiting maladaptive coping skills, the nurse is trying to determine the cause of the patient's behavior. From a growth and development perspective, what should the nurse recall? A. Individuals have uniform patterns of growth and development. B. Health is promoted based on how many developmental failures a patient experiences. C. Culture usually has no effect on predictable patterns of growth and development. D. When individuals experience repeated developmental failures, inadequacies sometimes result. Answer. D. When individuals experience repeated developmental failures, inadequacies sometimes result. Rationale. If individuals experience repeated developmental failures, inadequacies sometimes result is a true statement. Developmental failures could manifest with ineffective coping skills. However, when an individual experiences successes, health is promoted. Patients have unique patterns of growth and development that are not uniform. Nurses must consider the influence of culture and context on growth and development. Which theory of development asserts that learning precedes development? A. Vygotsky's theory of cognitive development. B. Piaget's theory of cognitive development. C. Erikson's theory of psychosocial development. D. Kohlberg's theory of moral development. Answer: A. Vygotsky's theory of cognitive development. Rationale: Vygotsky proposed that learning precedes development. One of the significant differences between the cognitive theories of Piaget and Vygotsky is that Piaget believed that development preceded learning. Piaget proposed that a level of cognitive development must be reached before learning could take place. Vygotsky thought that by viewing development and learning in this way, that adults would teach to the lowest ability, aiming instruction at those mental functions or intellectual operations that had already matured in the child. Erikson's theory of psychosocial development identifies the toddler stages: A. Trust versus mistrust. B. Initiative versus guilt. C. Industry versus inferiority. D. Autonomy versus shame and doubt. Answer: D. Autonomy versus shame and doubt. Infancy: trust versus mistrust. Toddler: autonomy versus shame and doubt. Preschool: initiative versus guilt. School age: industry versus inferiority. Adolescence: identity versus role confusion. Young adulthood: intimacy versus isolation. Middle adulthood: generativity versus stagnation. Older adulthood: ego integrity versus despair. The nurse knows that a priority reason for being knowledgeable about biophysical developmental theories is to A. Understand how the physical body grows. B. Predict definite patterns of cognitive development. C. Anticipate how patients' social behaviors develop. D. Describe the process of psychological development. Answer: A. Understand how the physical body grows. Rationale: biophysical development refers to how our physical bodies grow and change. Nurses and other healthcare providers are able to quantify and compare the changes that occur as a newborn infant grows into adulthood against established norms to detect abnormalities. Biophysical development refers to physical growth, not cognitive development, social behaviors, or psychological development. Which of these statements would be most appropriate for a nurse to state when assessing an adult patient for growth and developmental delays? A. How many times per week do you exercise? B. Are you able to stand on one foot for 5 seconds? C. Would you please describe your usual activities during the day? D. How many hours a day do you spend watching television or sitting in front of a computer? Answer: C. Would you please describe your usual activities during the day? Rationale: understanding normal growth and development helps nurses predict, prevent, and detect the deviations from patients' own expected patterns. The nurse can then compare expected patterns of activity based on age with the patient's stated activity patterns to determine deviations from the patient's own expected patterns. Asking the patient to describe his/her usual daily activities will provide the nurse with useful information about the patient's own expected patterns. How many hours are spent watching television or in front of a computer, and how many times the patient exercises in a week are closed-ended questions. These questions would not provide the nurse with as much information about the patient's expected patterns when his/her stated patterns are compared with expected patterns for the patient's age group. To detect delays, the nursing instructor will need to provide further instruction to the student who states A. Intellectual development is affected by cognitive processes. B. Socio-emotional processes can influence an individual's growth and development. C. Breast development is an example of a change resulting from biological processes. D. An individual's biological processes determine physical characteristics and do not affect growth and development. Answer: D. An individual's biological processes determine physical characteristics and do not affect growth and development. Rationale: human growth and development is a complex pattern of movement that involves changes in biological, cognitive, and socio-emotional processes. Cognitive processes comprise changes in intelligence, use of language, and development of thinking. Socio-emotional processes consist of variations in personality, emotions, and relationships with others. Height and weight, development of gross and fine motor skills, and sexual maturation resulting from hormonal changes during puberty are examples of changes resulting from biological processes. Piaget's stage of cognitive development states that characteristics of the sensory-motor stage include a development of egocentric, animistic, and magical thinking. B. Development of the concept of object permanence. C. Consideration of others' points of view. D. Thought dominated by senses. Answer: B. Development of the concept of object permanence. Rationale: development of the concept of object permanence occurs from birth to 2 years old and is in the sensory-motor stage. What is the alternative to the conflict of generativity? A. Industry. B. Inferiority. C. Stagnation. D. Despair. Answer: C. Stagnation. While assessing an 18-month-old toddler, the nurse distinguishes normal from abnormal findings by remembering that Gesell's theory of development states A. The developmental stage of the toddler is affected solely by environmental influence. B. Developmental patterns are not affected by gene activity. C. Skill development should be identical to that of other toddlers in the playroom. D. Environmental influence does not affect the sequence of development. Answer: D. Environmental influence does not affect the sequence of development. Rationale: Gesell's theory of development states that environment plays a part in child development, but it does not have any part in the sequence of development. Other factors influencing growth and development include biological, cognitive, and socio-emotional processes. Environmental factors support change and modify the pattern of development, but they do not generate progressions of development. Each child's pattern of growth and development is unique and is directed by gene activity. Not every child develops certain skills at the same time. Children grow according to their own genetic blueprint. Which of the following does not demonstrate the double standard in sexuality? A. Males are praised for more sexual partners while females are not. B. Females are praised for being nurturing and emotional while men are considered to be weak if they demonstrate such qualities. C. Males are more likely to not want their first sexual experience than females. D. All three options above demonstrate the double standard. Answer: D. All three options above demonstrate the double standard. Tabitha is 15 and has not seen her father for 11 years. She lives in a community in which her single-parent, father-absent family structure is typical. If we were to predict based only on these facts, research might lead us to guess that Tabitha A is more promiscuous than adolescents in intact homes. B will engage in sexual restraint longer than the average adolescent. C is highly morally committed to helping her community. D will have a hard time developing a clear gender identity. Answer: A is more promiscuous than adolescents in intact homes. Which of the following is a commonly cited limitation of Piaget's developmental theory? A. He offered no research data to support his theory. B. The popularity of his theory constricted and limited the range of research from other theoretical perspectives. C. He overestimated the importance of age differences in children's ways of thinking. D. He wrongly suggested that children actively promote their own mental development. Answer: C. He overestimated the importance of age differences in children's ways of thinking. In a typical test of theory of mind understanding, a child sees a doll, Maxie, put a candy bar in a blue cupboard. Then Maxie leaves the room and his mother comes in and moves the candy bar to a red cupboard. When Maxie returns to get his candy bar, the child is asked, in which cupboard will Maxie look first? What typically happens? A. Most 3 and 4-year-olds will answer, in the blue cupboard. B. Most 3 and 4-year-olds will answer, in the red cupboard. C. Most 3-year-olds will answer, in the red cupboard, but most 4-year-olds will answer, in the blue cupboard. D. Most 3-year-olds will answer, in the blue cupboard, but most 4-year-olds will answer, in the red cupboard. Answer: C. Most 3-year-olds will answer, in the red cupboard, but most 4-year-olds will answer, in the blue cupboard. Which of these is the correct order for Freud's psychosexual stages? A. Oral, anal, phallic, latency, genital. B. Oral, anal, phallic, genital, latency. C. Oral, anal, genital, phallic, latency. D. Oral, anal, latency, phallic, genital. Answer: A. Oral, anal, phallic, latency, genital. When utilizing Freud's psychoanalytical psychosocial theory, the nurse recalls that A. Adult personality is the result of resolved conflicts between sources of sexual pleasure and the mandates of reality. B. Development occurs throughout the lifespan and focuses on psychosocial stages. C. The genital stage precedes the phallic stage of development. D. Problems evident in adult life are due to early successes and resolution of earlier developmental stages. Answer: A. Adult personality is the result of resolved conflicts between sources of sexual pleasure and the mandates of reality. Rationale: Freud believed that adult personality is the result of how an individual resolved conflicts between sources of sexual pleasure and the mandates of reality. Freud had a strong influence on Erikson, but Erikson's theory differed from Freud's in that it focused on psychosocial stages rather than psychosexual stages. Freud's 5 stages of psychoanalytical development in sequential order include oral, anal, phallic, latency, and genital. The phallic stage precedes the genital stage. In theory, problems in adult life would be due to unresolved conflicts and failures. Which of the following is not one of the levels in ecological systems theory? A. Macrosystem. B. Endosystem. C. Exosystem. D. Microsystem. Answer: B. Endosystem. According to Kohlberg's theory of moral reasoning, stage blank focuses on consequences of punishment. A3B5C2D1. Answer: D1. According to Kohlberg's stage theory of moral reasoning, reaching the higher stages requires A. Passing through all the lower stages. B. An understanding of the writings of moral philosophers. C. An ability to understand the importance of altruism. D. The ability to focus on feelings and not just cognitions. Answer: A. Passing through all the lower stages. Suppose someone shakes a rattle in front of a delighted 4-month-old and then hides it under a pillow while the infant watches. According to Piaget, the infant is most likely to A. Look at the researcher, which suggests an understanding of cause and effect. B. Transfer attention to the pillow, which suggests an undeveloped attention span. C. Cry, which suggests an understanding of deprivation but an intolerance for frustration. D. Make no effort to find the object and even to lose interest in it, which suggests an inability to understand object permanence. Answer: D. Make no effort to find the object and even to lose interest in it, which suggests an inability to understand object permanence. Which statement is most accurate regarding the period of adolescence? A. The struggle between the parent and the teenager remains at the same level of conflict until the teenager moves out of the home. B. Rebellion is more closely tied to physical changes in boys than to chronological age. C. If puberty comes earlier than is typical, there is more conflict between the parents and the teenager. D. The conflict between parents and teenager ends at around 18 years of age. Answer: C. If puberty comes earlier than is typical, there is more conflict between the parents and the teenager. Which conflict does Erikson suggest those in middle childhood are trying to resolve? A. Initiative versus guilt. B. Industry versus inferiority. C. Intimacy versus isolation. D. Autonomy versus shame and doubt. Answer: B. Industry versus inferiority. Freud's phallic stage can be viewed as relating to which of Erikson's stages? A. Basic trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. D. Intimacy versus isolation. Answer: C. Initiative versus guilt. The nurse is planning playroom activities for a hospitalized 6-year-old patient. Which of the following age-appropriate items that the nurse should ensure are available? Select all that apply. A. Crayons and paper. B. Children's books circa 500-piece puzzle. D. Building blocks. C. Magazines and newspapers. Answer: A. Crayons and paper. B. Children's books. D. Building blocks. Rationale: the school-aged child thrives on feelings of accomplishment. Drawing pictures, looking at children's books, and building blocks are all ways that a child this age could play while developing a sense of accomplishment. A 500-piece puzzle would be too difficult for a 6-year-old child to complete without the possibility of getting frustrated. Magazines and newspapers would be written in at too high a reading level for a 6-year-old child. If play items offered to the child are too difficult, the child may become frustrated and may experience a feeling of inferiority. When developing a plan of care concerning growth and development for a hospitalized adolescent, what should the nurse do? Select all that apply. A. Stick with one developmental theory for consistency. B. Apply developmental theories when making observations of the individual's patterns of growth and development. C. Compare the individual's assessment findings versus established normal findings. D. Recognize his or her own moral developmental level. E. Apply the unidimensional lifespan perspective. Answer: B. Apply developmental theories when making observations of the individual's patterns of growth and development. C. Compare the individual's assessment findings versus established normal findings. D. Recognize his or her own moral developmental level. Rationale: no one theory successfully describes all the intricacies of human growth and development. Today's nurses need to be knowledgeable about several theoretical perspectives when working with patients. These theories form the basis for meaningful observation of an individual's pattern of growth and development. They provide important guidelines for an understanding of important human processes that allows the nurse to begin to predict human responses, not medical diagnoses, and to recognize deviations from the norm. Recognizing your own moral developmental level is essential in separating your own beliefs from those of others when helping patients with their moral decision-making process. Growth and development, as supported by a lifespan perspective, is multidimensional. A nurse should instruct the parents of a 10-year-old child to keep which of the following theoretical principles in mind when dealing with a behavioral problem at home? A. Strategies that worked well with the first child will be equally as effective for the second child. B. Encourage the child to volunteer some time at a local hospital to instill a sense of fulfillment. C. Bargaining about chores in exchange for privileges may be an effective method of encouraging helpful activities. D. Do not offer praise for accomplishments and punishment for behavioral issues. Answer: C. Bargaining about chores in exchange for privileges may be an effective method of encouraging helpful activities. Rationale: in the concrete operations period, children begin to cooperate and share new information about the acts they perform. Parents will be able to adjust their approaches to guide the child into helpful activities within the home, such as bargaining about chores in exchange for privileges. With the birth of a second child, most parents find that the strategies that worked well with the first child no longer work at all. After birth, children grow according to their genetic blueprint and gain skills in an orderly fashion, but at each individual's own pace. The need for a sense of fulfillment is usually experienced by middle-aged adults, not children. School-aged children need praise to discourage a sense of inferiority. Providing praise is the best choice for encouraging positive behaviors while nurturing growth and development. The teaching plan for a 3-year-old child who is at risk for developmental delay should include which of these instructions for the parents? A. Encourage play as your child is exploring his or her surroundings. B. Insist that your child discuss various points of view, not just his or her own. C. Discuss world events with your child to foster language development. D. Actively encourage your child to read lengthy books to expedite reading and writing abilities. Answer: A. Encourage play as your child is exploring his or her surroundings. Rationale: a 3-year-old child is going to use play to learn and discover the surrounding environment. Children at this age are egocentric and often are unable to see the world from any perspective other than their own. Very young children are not able to understand and comment on world events because their thinking has not advanced to abstract reasoning yet. A 3-year-old child is likely unable to read. Asking a child to perform an activity that is beyond his or her developmental abilities will likely result in frustration at not being able to complete the task. We can separate developmental models into either astaged or unstaged. B. Cognitive or neurological. C. Continuous or discontinuous. D. Psychosexual or psychosocial. Answer: C. Continuous or discontinuous. The parents of a 14-year-old boy express concern over their child's rebellious behavior. The nurse should plan to respond to the parents' concern by informing them that their child should be referred to a juvenile correctional facility. B. Child's behavior is normal because the adolescent is trying to adjust to his emerging identity. C. Child's behavior is a matter of concern because he is likely conflicted about establishing companionship with a partner. D. Child's behavior is expected because he is expressing his need to support future generations. Answer B. Child's behavior is normal because the adolescent is trying to adjust to his emerging identity. Rationale. According to Erikson, a 14-year-old adolescent is developing his identity versus role confusion. A teenager is very concerned with self and is often preoccupied with body image. Frequently, teenagers express themselves rebelliously as they struggle to discover their own identities. Rebellious behavior is very common and normal at this stage of development. A juvenile correctional facility usually is not necessary. Establishing companionship occurs in the young adult age group. Feeling the need to support future generations is usually experienced by the middle-aged adult. A formerly independent and active older adult becomes severely withdrawn upon admission to a nursing home. When approaching this patient, which intervention should the nurse plan first? A. Offer reward for participation in all events. B. Encourage the patient to attend all social events scheduled for the patients. C. Allow the patient to incorporate personal belongings into her room. D. Advise the patient of the importance of attending mandatory activities. Answer. C. Allow the patient to incorporate personal belongings into her room. Rationale. The older adult is in the mature thinking stages of development according to Piaget and Kohlberg. According to Gould, the older adult needs help in realistically appreciating her accomplishments and in fostering continued development. Erikson's theory proposes that the older adult faces integrity versus despair. To avoid despair, the nurse should allow the patient to actively participate in an independent activity, such as preparing his or her own room with personal belongings. Offering a reward does not address the need for continued independence. Encouraging participation in social events again does not address independence, and the question is asking for the best first intervention. Advising the patient to attend all mandatory activities as the first intervention does not allow for the patient's independence. Some activities may be mandatory, but by first allowing the patient to decorate her room, the nurse is fostering independence and is helping the patient feel welcome and more at home. Which of these manifestations, if identified in a 6-year-old patient, should the nurse associate with a possible developmental delay based on Piaget's theory? A. The child speaks in complete sentences but often talks only about himself. B. The child still plays with a favorite doll that he has had since he was a toddler. C. The child continues to suck his thumb. D. The child describes an event from his own perspective even though the entire family was present. Answer. C. The child continues to suck his thumb. Rationale. This is a characteristic of the sensory-motor stage, birth to 2 years, where schemas become self-initiated activities. For example, the infant who learns that sucking achieves a pleasing result generalizes the action to suck fingers, blanket, or clothing. Successful achievement leads to greater exploration. By age 6, the child is in the preoperational stage of development. The child is expected to be egocentric even though language ability is progressing. Play becomes a primary means by which children foster their cognitive development, therefore playing with a doll is considered normal at this age. Children see objects and persons from only one point of view, their own, at this stage. According to Piaget's formal operations level, a 13-year-old adolescent will likely A. Hit other students to deal with environmental change. B. Use play to understand her surroundings. C. Question her parents about an upcoming presidential election. D. Question where the ice is hiding when ice has melted in her drink. Answer. C. Question her parents about an upcoming presidential election. Rationale. In the formal operations period, Adolescents and young adults begin to think about such subjects as achieving world peace, finding justice, and seeking meaning in life. Asking about a presidential election demonstrates that the adolescent is concerned about political issues that affect others besides her. Hitting would be a common schema during the sensory-motor stage of development. Using play to learn about the environment is indicative of the pre-operational stage. During the concrete operations stage, ages 6 to 12 years, children are able to coordinate two concrete perspectives in social and scientific thinking, such as understanding the difference between hiding and melting. Jean Piaget's cognitive developmental theory focuses on 4 stages of development, including A. Formal operations, B. Intimacy versus isolation, C. Latency, D. The post-conventional level. Answer: A. Formal operation rationale. Jean Piaget's theory includes 4 stages in sequential order: sensory motor, pre-operational concrete operations, and formal operations. Intimacy versus isolation is part of Erikson's psychosocial theory of development. Latency is stage 4 of Freud's 5-stage psychosexual theory of development. The post-conventional level of reasoning is part of Kohlberg's theory of moral development. The nurse is teaching a young adult couple about promoting the health of their 8-year-old child. The nurse knows that the parents understand the developmental stage their child is in according to Erikson when they state, "We should A. Provide proper support for learning new skills. B. Encourage devoted relationships with others. C. Limit choices and provide harsh punishment for mistakes. D. Not leave our child at school for longer than 3 hours at a time." Answer: A. Provide proper support for learning new skills. Rationale: in 8, your child would be in the industry versus inferiority stage of development. During this stage, the child needs to be praised for accomplishments such as learning new skills. Developing devoted relationships is part of the identity versus role confusion stage, usually occurring during puberty. During the autonomy versus shame and doubt stage, limiting choices and harsh punishment lead to feelings of shame and doubt. Separation anxiety is usually a part of the trust versus mistrust stage. What developmental period does a human go through from approximately 6 to 11? A. Prenatal, B. Early childhood, C. Middle childhood, D. Adolescence. Answer: C. Middle childhood. Which of these approaches would be most appropriate for the nurse to use when teaching a 4-year-old patient about a scheduled surgery? A. Give the parents a book to read about the procedure and do not discuss the procedure with the child to decrease anxiety. B. Set boundaries before teaching by telling the child that she can ask only 3 questions because time is limited. C. Insist that the parents wait outside the room to ensure privacy of the child. D. Allow the child to touch and hold medical equipment such as thermometers and syringes. Answer: D. Allow the child to touch and hold medical equipment such as thermometers and syringes. The parents of a 15-month-old child express concern to the nurse about their child's thumb-sucking habit. Which of these explanations related to the child's age and developmental level would be most appropriate for the nurse to give the parents? A. Thumb sucking at this age indicates a developmental delay and should be further assessed. B. Sucking achieves a pleasing result for infants and generalizing that action by thumb sucking is normal. C. Thumb sucking at this age demonstrates a transition away from egocentric thinking. D. At this age, thumb sucking will enhance language development. Answer B. Sucking achieves a pleasing result for infants, and generalizing that action by thumb sucking is normal. An 18-month-old patient is brought into the clinic for evaluation because the mother is concerned. The 18-month-old child hits her siblings and says only "no" when communicating verbally. According to Piaget's theory, what recommendation should the nurse make a priority? A. Consult the social worker because the child is hitting other children. B. Reassure the mother that the child is developmentally within specified norms. C. Encourage the mother to seek psychological counseling for the child. D. Remove all toys from the child's room until this behavior ceases. Answer B. Reassure the mother that the child is developmentally within specified norms. Rationale: at 18 months, the child is in the sensorimotor period of development. Piaget describes hitting, looking, grasping, and kicking as normal schemas to deal with the environment. The social worker does not need to be consulted in this case, nor is psychological counseling warranted, because the child is exhibiting normal behaviors. Play is an important part of all children's development. Removing the toys is not necessary because this child is exhibiting normal behaviors. Removing toys and the opportunity to play with them may actually hinder the child's development. According to Piaget's theory of cognitive development, the nurse should allow a hospitalized 4-year-old patient to safely play with A. The pump administering intravenous fluids. B. The blood pressure cuff. C. A baseball bat. D. A book to read alone in a quiet place. Answer B. The blood pressure cuff. Rationale: a 4-year-old child would be in the preoperational period. Children at this stage are still egocentric. Play is very important to foster cognitive development. Children should be allowed to play with any equipment that is safe and should be allowed to communicate feelings about their health care. The IV pump is not a safe piece of equipment for a 4-year-old child to play with. A baseball bat typically is not found in a hospital setting and is a potentially dangerous toy to play with in the hospital. The blood pressure cuff is a safer option. A 4-year-old child is of preschool age and more than likely is not able to read yet. Also, the book does not allow for any human interaction and communication if read alone. The nurse is aware that preschoolers often display a developmental characteristic that makes them treat dolls or stuffed animals as if they have thoughts and feelings. This is an example of 1. Logical reasoning 2. Egocentrism 3. Concrete thinking 4. Animism. Answer 4. Animism rationale. This is the belief that inanimate objects have lifelike qualities. It is a component of magical thinking evident in preoperational thought.